Thank you all for being here today and for your patience. I'm London Breed, Mayor of San Francisco, and I am joined by President of the Board of Supervisors, Supervisor Norman Yee, as well as the Director of the Department of Public Health, Dr. Grant Colfax, and other members of the Department of Public Health. We are here today because there was a very unfortunate situation that has occurred at Laguna Honda. Laguna Honda Hospital is a place that has taken care of so many vulnerable residents, people like my grandmother, for so many years. My grandmother suffered from dementia, and she was at Laguna Honda for many years before she passed away in 2016. I want to say that the care and the support and the compassion from so many of the employees at Laguna Honda meant a lot to me personally and meant a lot to my family. But these particular acts that have occurred by a few individuals will be addressed. Dr. Colfax will provide some of the details in terms of what has happened, and we are already taking swift action to address those issues, and I want to thank him and his department for being steadfast in the work to address these issues, in addition to providing new leadership to make sure that this doesn't occur again. We are better than this. We are committed to restoring the trust of the families and the patients of Laguna Honda. And we thank you all so much for being here, as well as I said, many of the folks who are part of Laguna Honda. We have work to do, and we are committed to making sure that situations like this that have occurred don't happen again. And at this time, I'd like to ask President of the Board of Supervisors, Norman Yee, to say a few words. Laguna Honda is located in his district.
Thank you, Mayor. I'm kind of speechless when I found out about this situation, and I'm super outraged with what has occurred. Like Mayor Breed, this is personal to me. I've had family members stay there. I still have friends whose parents are being cared for. So for this to occur in our watch, it's just I don't have the words to express how upset I am. When people send their loved ones there, they like to be able to trust that they're going to have the best care. And for the most part, at Laguna Honda, I would say they have received that. But for these few staff members that have perpetrated these incidents, I'm with Dr. Colfax. Let's make this a very quick reaction, not only to find out what happened, but what's more important moving forward is that we really need to figure out how to prevent something like this from ever happening again. Because again, when one sends their loved one there, they want to feel comfortable. They do care what happens, and they have to trust us, and we should do the best we can. And because of that, I don't know, when we're ready, I'm going to call for a hearing at the Board of Supervisors to find out what exactly happened and what are the measures that will guarantee that this will never happen. So I want to thank Mayor Breed for acting quickly, and I want to also thank Dr. Colfax for what he's done so far. Thank you very much.
Thank you, President Yee, and now Dr. Grant Colfax to provide more details about what has occurred.
Good afternoon. Thank you, Madam Mayor, and thank you, President Yee, and thank you all for coming today on such short notice. We are here to report something difficult, disturbing, and disappointing to the people of San Francisco. In February of this year, while investigating an unrelated personnel matter, the department uncovered the possibility of patient mistreatment at Laguna Honda Hospital. We immediately started an internal investigation and found evidence to substantiate our initial suspicions. We contacted the San Francisco City Attorney to help us conduct a more formal and comprehensive investigation. We reported our evidence to the California Department of Public Health and to the San Francisco Police Department. And we dispatched the Department of Public Health quality and safety team to gather all the relevant facts and to make recommendations. We now want the people of San Francisco to hear directly from us about our findings and what we are going to do about them. We discovered that 23 residents were affected dating back to 2016. 6 staff members were involved, and they are no longer employed by the Department of Public Health. The misconduct we discovered included sexualized conversations with residents, verbal and physical abuse, neglect, privacy violations, medication errors, and the administration of non-prescribed substances to some residents in an attempt to pacify them. This behavior is not something we will tolerate. This behavior is not something I will tolerate. As a caregiver, I am outraged and heartbroken that our patients were treated this way. I apologize to them and to their families. In response to our findings, we have immediately taken steps to ensure patient wellness and safety. We have removed the Chief Executive Officer and Chief Quality Officer of Laguna Honda Hospital. We have notified all affected patients and their decision makers or their conservators. We have thoroughly examined all affected patients to ensure their health and wellness. We have informed all relevant regulatory and law enforcement agencies. We have retrained staff in prevention and reporting of patient abuse, and we have improved drug security, dispensing, and testing practices. There is no evidence that these abuses continued past January of 2019. And extensive investigations and interviews with staff confirmed that these abuses were limited to 2 units of the hospital and to a minority of patients in those units. Today, we are confident that Laguna Honda continues to be a good place for patients, especially in the areas of patient care and safety. We want to ensure it continues moving in the right direction so these circumstances never occur again. Our acting CEO, Maggie Rakowski, will lead our process of recovery from these incidents, and we will fully engage our hospital staff in recommitting to our mission, values, and work. And we will continue to work in close collaboration with the California Department of Health and are cooperating fully with their investigation. Additionally, the Health Department will undertake a turnaround plan for Laguna Honda, informed by external experts in long-term care and working in partnership with the community, patients and their families, and health department leaders. We will submit our plan for moving forward to the mayor, to the Board of Supervisors, and to the Health Commission within 60 days. Anyone with concerns about patient care or staff conduct is asked to call the confidential Department of Public Health Compliance Hotline at 855-729-6040, 855-729-6040. Now, Roland Pickens, the director of the San Francisco Health Network, and I will answer a few questions. As there are still ongoing investigations, we may be limited in what we can say at this time, but we thought it was important that the community hear from us directly, and that is why we are here today. Thank you.
Dr. Colfax, have any of these 6 been either arrested or criminally charged, or is this all administrative in nature?
All 6 employees have been removed from employment. There's an ongoing police investigation.
What about the CEO and you talked about the CEO and the director of quality care were moved out of those positions, but you didn't say that they were no longer working for the city. Can you clarify that?
They have been removed from the positions, and we have a new CEO, Maggie Rakowski, as our.
Are they still working for the city? in some capacity?
That's a personnel matter, and I can't specify any further than that they've been removed from their positions as of today.
So this happened over 2.5 to 3 years. Were there any reports before now? Were there reports along timeline?
As I mentioned, we first became aware of these issues in February of this year, February of 2019. And one of the things that concerns me is that as a culture, within in the context in which these employees were working, that there was a culture of silence. And that's why we need to make this change. So we need to move from a culture of silence to a culture of safety.
What is the mechanism for checking out meds to sedate patients? Is there a login system with somebody not monitoring that login system to see that those meds are being given out of turn?
We have reinforced medication prescription and security, and I'll let Roland Pickens provide you with more details.
Thank you, Dr. Colfax. I'm Roland Pickens, Director of the San Francisco Health Network. In answer to your question in terms of medication management, there are medication rooms on each of the patient units at Laguna. Those rooms have computerized medication cabinets that hold the drugs. There are also medication carts that are used to bring medications out of the room and onto the patient units. Obviously, the systems that were in place at that time didn't catch what happened in terms of some of the inappropriate medication use. As Dr. Colfax said, we've taken steps to remedy that right away and are continuing to analyze the process. There have been increased monitoring oversight by pharmacists at Laguna Honda. They've doubled their log checks, going from once a week to once a day. And they will continue as we bring in consultants to really help us analyze what have been the gaps that led to this behavior and what do we need to do to fill those gaps.
We have time for one more question. Yeah.
What about the patients, their ages, what kind of
Yes,
diseases they are
yes.
suffering from?
Thank you so much for asking the question, because this is all about keeping our patients safe. Those 23 patients range in ages from 30 to 100.
And
And
can
what
you
they
finish your
suffer
question in terms of their ailments?
I'm sorry, say
What
that.
they suffered from, their diseases?
Yeah. So again, these were patients on North 1 and North 2, and those two units specialize in dementia care.
They're vulnerable people.
You mentioned the drugs. Were they prescription or not? Were they controlled drugs that were handed out?
Yeah, so controlled substances are available, so it's a mixture of both controlled and non-controlled
Is there
substances.
enough photo,
Are taken from that floor?
can you tell us more about the photo and video recording?
Thank you all so much. We really appreciate it. Thank you.